Glaucoma is basically a condition which is defined by a group of diseases which can result in the damage of the optic nerve, which is due to the pressure or the increased pressure in the vitreous chamber, or the intraocular pressure is raised in these group of diseases. So this is the mainstay over here, that we are focusing on this increased in the intraocular pressure, and that is going to subsequently result in the different structures of the eye, which is going to result in a permanent vision loss in these patients. In the layman terminologies, they're also known as the hot splinters. They are usually going to cause a rubor due to the inflammatory processes that are occurring in the eye, and subsequently the structures that are going to damage in the eye are the optic nerve, as well as the ciliary bodies are sometimes affected, and as well as the anterior chamber angles are sometimes blocked due to this subsequent rise in the intraocular pressure in the vitreous chamber. So these are the characteristic of these, or these are the clinical symptoms and signs of this condition, which is known as the glaucomatous condition over here. Knowing or having the knowledge of this primary clinical signs and symptoms and the particular pathophysiology of this glaucomatous condition, which is basically we divide this glaucomatous conditions into two types, mainly the angle closure glaucomas as well as the open angle glaucomas. So what basically happens over here is the trabecular meshwork or the canals of sclem are blocked to the level. Sometimes they are partially blocked and sometimes they are completely blocked. So these blockages are going to hinder the aqueous humor outflow, and that is going to subsequently result in a rise in the intraocular pressures. So this is the basic or the main pathophysiology behind this condition, which is known as glaucoma. So what are the diagnostic criteria that are more feasible for the clinicians to diagnose this condition and to treat them accordingly? So knowing this condition and having the clinical signs and symptoms in a particular patient, we want to diagnose the patient to be suffering from glaucoma. What are the primary characteristics for this condition? We'll be discussing that over here in this section, and then we'll be moving on to the treatment modalities depending upon the kind of the glaucomatous condition that the person is suffering from. The different causative factors are again very important, ranging from the congenital causes in which the canals of sclems are not patent or are not functional in that particular infant. So if there is some sort of a congenital problem with the canals of sclems, that can be surgically treated to treat the eye, and as early diagnosis is made, the prognosis is much better in these patients. So if you have an infant with an increased intraocular pressure, he should be investigated for the patent canals of sclems, whether there is some sort of a problem with them or not. Then the other causes of the development of the glaucoma are the infectious causes. We have the traumatizing conditions. We have the inflammatory causes ranging from the keratitis, it can be the uveitis, and all of these corneal ulcerations can result in an increase in the intraocular pressure in the patient. The parameters which make the diagnosis more viable over here, we'll be discussing them over here in this second section, and we'll be moving on to the different stages of this pathological condition. First of all, ranging from the earliest signs and symptoms, usually that is the clinical picture over here in this case is the peripheral loss of vision, and that is usually not noticed by the patients or overlooked by the patients. So these stages are concerned over here, and then moving on, we'll be discussing the more advanced stages of this glaucomatous condition over here. The treatment guidelines will also be discussed along with them, depending upon the causative factors for the development of the increased intraocular pressure. Obviously, sometimes the drug therapy is coupled up with the surgical treatment, so we'll be discussing the medical management along with the surgical parameters for the treatment plan of the patient who is suffering from this glaucomatous condition. So over here, you can see the complete structure which is involved in the outflow of the aqueous humor. That is basically located at the angle of the anterior chamber. Here you can see there is an iris, which is basically a muscular movement of the iris is also going to help the outflow of the aqueous humor as well. There is a closed angle over here. The canals of Sclems are located over here. We have the episcleral vein that can be visualized over here. The aqueous vein is somewhat over here. We have the trabecular meshwork that is present over here, and that is again going to basically help in the drainage of the aqueous humor. The ciliary bodies are placed over here. They have their contractile motions, and we have the aqueous outflow from this side as well. So this complete apparatus is basically helping the aqueous humor, the circulation of the aqueous humor. Usually the ciliary bodies are present, and that is basically responsible for the production of this aqueous fluid, and the outflow is controlled by the canals of Sclem. The origin is primary. It can be idiopathic. The disease has not, basically, there's an unknown cause to the development of this disease in the secondary kind of a glaucoma that is usually associated with the ocular or the systemic conditions. Now, what are the ocular and the systemic conditions that we can see over here? It can be any trauma. It can be any infectious or inflammatory conditions. It can be other autoimmune disorders that can again result in the development of this condition in which we have an increased intraocular pressure in the eye. So these are some of the parameters that we have to look upon over here. In the state of the anterior chamber angle, there is an open angle type of a glaucoma, and sometimes there is a closed angle kind of a glaucoma. So these are somewhat the types, these are mainly the types of the glaucoma that we can discuss. If the trabecular meshwork is completely blocked, it is categorized as a complete or a closed angle glaucoma. Or if there is a partial blockages of the canals of Sclem, it is characterized as the open angle glaucoma in these patients. Considering the parameters of glaucoma, talking about the chronicity of the disease is again very important. It can be an acute span of a disease in which there is a short duration. The patient gives you a history of the peripheral loss of vision, which was followed by a central loss of vision quite suddenly. So sometimes it can be an acute condition. There are a range of causes that can result in an acute course of a glaucomatous condition, ranging from inflammation as well as trauma. And on the other hand, it can be a chronic condition. So usually the congenital sort of a glaucoma is of the chronic kind. The canals of Sclems are not patent and in such an infant, and that is going to basically partially block the outflow of the aqueous humor, raising the intraocular pressure subsequently, damaging the optic nerve subsequently, and this process is an ongoing process. And finally, usually later in the life, the patient is going to be diagnosed with this glaucomatous condition, which was basically congenital. So this is usually the course that happens in a chronic kind of a condition of the glaucoma. Then we have a lot of diagnostic parameters out there that we have to consider in these patients as well. First of all, the tonometer. Tonometer is basically for the measurement of the pressure in the eye. That is basically the intraocular pressure. The patient is asked to sit, and usually there is a slight blow towards the eye, and that is the whole process. And then you have an automated calculation of the intraocular pressure, and through that measurements you can basically compare these readings with the normals, and you can visualize whether the patient has an increased intraocular pressure or not. The pachymeter is one of the devices that is used for the measurement of the corneal thickness. So one of the things that you have to calculate over here, just to see whether there is an inflammatory process, ongoing inflammatory process in the cornea or not. So one of the things that you can imply over here is the pachymeter. Then we have the visual field testing. That is usually, there are again the manual methods for the performance of this visual field testing, whether there's a visual field defect or not. You have the Amsler grid charts, you have the Herm-Fraze methods for the visual field testings that are being performed. And on the basis of that, you see whether there is a peripheral vision loss or whether there is a central vision loss in the patient. The ophthalmoscopy is performed in these patients as well. There is sometimes a direct observation of the optic nerve. So this is the mainstay over here, that you perform this direct observation of the optic nerve in these patients as well. And you see the imaging technology, it scans the optic nerve and it also gets a hold on the retinal nerve fibers as well. So these are the diagnostic parameters that can be performed through the ophthalmoscopy. You're going to visualize if there is a healthy optic disc, if there's a healthy fundus, if there is any damage towards the vessels of the retina or not. So all of these findings are to be noted down and documented in detail when you're writing down the clinical findings. Gonioscopy is performed, use of the mirrors to see the interior of the eye. Again, it is basically focusing to see the fundus of the eye. The stages usually consist initially no symptoms, pain, or the loss of vision is visualized in these patients, and then subsequently there is a loss of the peripheral vision, and then finally the visual field gradually narrows into a tunnel vision. So this is the slow progression, or these are the stages that are observed in the vision loss in these patients of the increased intraocular pressure, and if followed to progress without treatment, it can lead to a complete loss of vision in these patients if they are untreated in such a case. The treatment usually depends upon the increased fluid drainage or a decreased fluid production. So the drugs are usually implied to decrease the fluid production in these patients, as the canals of Slem's are not patent in these patients. The medicated eye drops are given to the patients, as well as the oral prescriptions can range from betagen, it can be pilocarpine, it can be propine, and it can be the thymoptic drugs. So these are the drugs that are basically given to decrease the fluid production or the aqueous humor in the patient. Then we have the surgeries that basically range from the traditional surgeries, and on the other hand, we have the lasers that can be performed to have the more patent canals of Slem's in the interior chambers. The angle of the interior chambers are opened in cases of the angle closure glaucomas in these cases. The key facts that we have to consider for the patients of the glaucoma are it affects almost 65 million people worldwide, and there is no cure for this disease, but obviously we can make the condition more pliable for the patient by performing the surgeries, or by giving the oral medications, or by giving the topical medications in the form of eye drops to the patients. Glaucoma is one of the leading causes of blindness, so the early diagnosis is again very important, and it basically forms the foundation for the development of the treatment plan in the patient. The leading cause of blindness in Africa Americans is almost 6 to 8 times more common in Caucasians. So it accounts for over 7 million physicians it visits annually over there. So in this section, basically, we focused on the facts that what are the different kinds of the parameters that we have to calculate when we have a patient of glaucoma at our hand. What are the different clinical stages of the vision loss that are observed in the patients of glaucoma, and what are the key facts that we have to keep in mind whenever we are dealing with a patient of glaucoma, because these key facts are important before we design a treatment plan for this particular patient. So that is the end of this section. Thank you for watching sqadia.com.